My name is Damaris Wayaki, and my research was on cognitive behavior therapy, known as CBT. CBT explores the links between thoughts, emotions, and behavior. It is a directive, time limited, structured approach used to treat a variety of mental disorders. In other words, CBT aims to change thought patterns, the beliefs we may not know we hold, our attitudes, and ultimately our behaviors to help us face our difficulties and effectively strive to our goals. CBT came about in the 1960s, and it was developed by Aaron Beck. CBT differs from other therapies in the manner that CBT has functional analysis of relationships between thoughts, emotional problems, behavior, substance use, and environmental influences. Has individual training in recognizing and coping with dysfunctional cognitions and physiologic responses causing problems. CBT recognizes risk factors, triggers, and seemingly irrelevant decisions and how to deal with impulse and urges. CBT identifies and debriefs of past and future high-risk situations. CBT has encouragement and review of extra session implementation of skill. In CBT, this practice of skill in session. CBT is rooted in the behavior principle and is always adapted to the needs of the individual. And this is more on the multicultural application. And in CBT, every individual is considered as in control of their thoughts, and in cases where the individual speak another language, they are offered therapy in their first language, and their problems are able to be assessed. And in my presentation, I have attached 3 resources that can be looked at. There is an article by Dr. Gupta. Let me confirm the name. Not Gupta. Dr. Bhardwaj. It's attached at the bottom of my notes. And there's also an article from the ASU library that talks more on CBT. There's also a website on positive psychological program, which talks about techniques and workshops for cognitive behavior therapy, which provides more information on CBT. And my client today is a 21-year-old third-year college student, and I'm going to invite him to come join me, and we'll see why he came to see me today. Welcome, sir.
Hello.
Hello. So why are you here today?
Well, I'm here today because I've kind of recognized some risk factors in my impulses and urges.
What do you mean you've discovered some risk factors in your impulse and urges?
For example, when I have a heavy academic load, I kind of tend to rely on antidepressants.
So, are you trying to tell me that your schoolwork is making you take antidepressants, or are you depressed?
Both.
What do you mean both?
Well, the schoolwork kind of adds upon the depression. And by having that, it's kind of
How can you tell? What makes you say you have depression?
the fact that I rely on these drugs to make me
What
feel a certain
triggers
way.
you? What triggers you to use these drugs?
When I feel really agitated, irritated, or I just can't, progress within my own motions. So it kind of triggers me to find a urge to just take these drugs so that I can feel that I'm doing something better for myself to get away from these, impulses I'm currently having.
So do you go purchase drugs, or you live around people who give you drugs, or?
Well, there was a time period where I was prescribed to these drugs, but then I stopped getting the prescription, and then I started just taking certain drugs from other people.
So you try to medicate yourself?
Yes.
And has this helped or made it worse?
For a certain time period, I thought myself it made it better for myself, but through careful, just debriefing of myself and kind of understanding that, it's kind of led me to risky situations to where I don't feel that if I don't take the drug, I'm going to be okay. I feel like I need to take the drug to be okay.
So do you want to stop the drugs, or you want to take the drug?
I want to stop taking the drug.
And how can we stop the drug?
I don't know. I'm trying to figure that out as this problem has been ongoing. I feel maybe if I start finding different methods of, encouraging myself to not do these drugs, implement new kind of daily routines that can kind of change me from alleviating the different burdens I feel that I have on me.
So what are these kind of daily routine you think you should incorporate in your life?
Maybe shopping, maybe working out, maybe writing, maybe going out and just taking a walk. Maybe those can be different daily routines I can incorporate into my daily lifestyle to encourage myself to stay away from these drugs that are caused by these different impulses that I get when I feel depressed or stressed out.
That's a good idea.
Okay. So how can I go along and incorporate
all the good things you just said? You can incorporate them when you have the urge.
Okay.
You can go to the gym.
Okay.
You can go shopping if
Okay.
you have the money.
Okay.
And if you feel like the workload is school workload, you can always take a break and go to the gym other than going to the drugs.
Okay.
Because it seems the drugs are the one causing you stress.
Okay.
So we're gonna stop our session right here, and I will see you in a couple of days. And before we leave, we will review what we discussed, and we see how you can work on your progress.
Well, I have a couple questions for you before we separate ways.
Mm-hmm.
So in terms of incorporating these daily routines and implementing them into my, practicing of getting away from the urge of taking these drugs, is it something that I should incorporate at every moment I have an urge to take these drugs? I do that thing that takes me away from taking these drugs so I can feel relief?
Yes, to stay away from the drugs.
Okay.
As much as you can.
Okay.
Like, if you see a friend who shows up and you know that they're gonna show up with drugs, the best way to do is to stay away from them.
Okay. So in terms of, do you feel as if I stop taking the drug and incorporate these different ways, my impulses?
You will. It's not gonna be a one-day thing.
Okay.
You have to train yourself.
So it's gonna be like a long-run mitigation process to stay away from this.
And then you have to change the way you think too about your schoolwork. When you think about your schoolwork, it makes you depressed.
Yeah.
And you go take your drugs.
Okay.
So you have to see your schoolwork as a good thing for your future, And instead of going to the drugs,
Mhm.
you can go to the gym, which is also good for your health.
Okay. What if I do both? Would that make me
Do both. What do?
do drugs and then go? Because I've tried
You're not solving the problem.
So I should just stay away from these antidepressants that I've been taking.
Yes, because they're not prescribed, unless they're prescribed by the doctor.
What if they are prescribed? What if I go back to the doctor again and they tell me
You take as per the doctor's prescription, not abusing them.
Okay, so if the doctor does prescribe it to me, I should take it.
Yes, because the doctor knows your diagnosis and should be able to treat it to them. But now you are taking them and abusing them and not prescribed by the doctor.
Okay.
So we're gonna meet on the next session.
Okay.
And then we're gonna see the progress, and then we're gonna revisit. Thank you.